Welcome to this special meeting on the county employee health insurance renewal. Heather?
I'm gonna give it to Chad, actually, we'll just go over, we have the custom design benefit admin fee renewal, the stop loss renewal, and then we have script sourcing that we're hoping to bolt on to our current plan to kind of help us save with some pharmacy. And then we had a meeting with the committee and they voted yes on all of this. So this is just our recommendation to you guys.
Let's start with the admin fee. I think that's probably the most straightforward. It's gonna be the single page, green looking documents. So this is the admin fee to pay the third party administrator to essentially administer the entire plan. They're the ones processing and paying claims. They are the ones answering members' phone calls. They are the ones dealing with provider issues. They also help with some things like compliance and regulatory support. They handle FSA, so their fee is increasing a quarter, so 25 cents per employee per month.
That was at 20 cents.
I think that's, a reasonable increase. We typically see anywhere 2 to 3% on average, across our book of business regarding the admin fees. I don't believe we got an increase last year, so I think, that they're trying to get a little bit higher just to kind of keep pace with inflation, which is,
A quarter.
we'll take it, we'll take it.
Sure, I'll take it.
Yeah, we'll take it.
I wish inflation were just a quarter.
I know, me too. So yeah, we're just seeking your approval to renew with custom design benefits as the continued administrator going forward. And to do that, we'll just need one person's signature on that particular agreement.
So we want to make a motion to accept this proposal for 25 cents.
I make a motion, we accept the proposal for the increase from custom design benefits.
Appreciate that.
I'll second that motion.
Any other discussion? All those in favor signify by line. Okay. All right.
All right.
Now we get to the end and forget all that.
Yeah,
At this
right.
meeting, and we're like, oh, wait a minute, we forgot.
Let's do we'll do the stop loss renewal next. So let's look at the one that says, it's a blue document, there's Virtue on it, which is our stop loss provider. And we went to a couple different stop loss carriers, as you kind of flip through, I'll kind of talk through what we've done so far. So we looked at stop loss carriers like Sun Life, Tokyo Marine, HCC, we looked at Pareto Captive, we looked at a couple of different stop loss providers. And none of them could come close to the rates that we were able to get in the renewal, and some of them actually declined to quote, most likely because they just couldn't get competitive. And so you'll see the renewal on going to be, I think the page numbers are covered. So it'll look like this. You'll actually see kind of the renewal numbers that are going to be on this page. And so you'll see a couple lines, and we'll go through it. I think right there you go. Right there, yep. So there'll be a couple different parts on here. On the top, right here, you'll see the stop loss and aggregate rates. Those are increasing 5%, and those are fixed costs, so it's about an annual cost of $15,000 increase. A little over $1,000 a month. But you'll see a decrease on what we call our aggregate claims factors. So that in that situation, they're saying you're a better risk. Jefferson County's total potential liability is actually going down, right? So they're getting a small fixed cost increase, but the total potential liability is getting a decrease. And then on the bottom, you'll see the max cost row. So when you kind of net those out, we're kind of averaging or expecting like a 4.6% decrease over what this year's projections were. We think, it's kind of part of the reason why we weren't able to get very many competitive options, is because
We're not gonna make any money off of it.
because, yeah, they look at it and they said, hey, we can't do that. So, the good news is, this has been a good partner for us over the past year and a half. We believe it's a pretty fair renewal, especially when we look at competition. Again, it doesn't, it's not gonna preclude us from looking again next year or continuing to try to shop and find the best rate. But this, at this point, would be the best to do now. And now, for this particular agreement, if we're not making any changes, we don't need any signatures, but we still like to request a motion to just approve the decision to renew as is with the current stop loss insurance.
We don't have anybody left out like the one time, right?
The
On the
laser.
laser.
No, this is what we call a no new laser contract,
Good.
and so when.
That was a fiasco,
Yeah.
so, okay.
Yeah, and so this is, we don't ever have to worry about lasers again. So that was one of the reasons why we moved to this organization in the last year,
Good
right, last
deal.
year. Was because we were able to get a contract that said no lasers, right? And so that kind of will help us going forward, you know, hopefully limit something like that from ever happening again.
Entertain a motion to accept the proposal for the renewal. For the stop loss.
I make a motion to accept the new renewal of the stop loss.
Any other discussion? All those in favor, signify by aye.
And then the final one is going to be the bolt-on, prescription drug program. The first couple pages have just information on the program. I mean, I'll talk through it, but the page that I'm gonna be referencing as we kind of look through this is going to be the ones with the actual numbers and the savings analysis on the second one. So if you open it up, there'll be two kind of pages of medications. And so what script sourcing does is they, help us source medications more cost effectively through a couple of different mechanisms. First option is what we call through a MAP or a PAP, so it's a manufacturing or patient assistance program. This could be through drug manufacturer programs, it could be through patient foundations, it could be through certain disease diagnoses foundations. All of these programs out there oftentimes have drugs that we're able to get more cost effectively than simply purchasing at the pharmacy or through like a standard specialty pharmacist. Usually, if we're able to source through one of those medications, we're able to get the medication for $0. If that doesn't work, step two is they have an international sourcing mechanism where they're sourcing the exact same medication and the exact same packaging from the exact same manufacturer in climate controlled containers, at typically 20% to half the cost that we pay here in the States. I can give you an example. Ozempic, I'm sure we've all heard of Ozempic. That medication here in the States costs somewhere between $1,200 and $1,500 per script. So you think it's anywhere from, you know, $10,000 to $15,000 annually. The same medication in a tier one country at a approved pharmacy in Canada costs about $333 per script. And so, you know, what we're able to do is help members kind of opt into the program. Not only will they save on their prescription drugs, but it will also help projection, you know, we're projecting to save the county quite a bit of money on prescription drugs. And so this saving analysis page, you'll see all the medications that we identified that we believe we can source through the program. And then on the right, you'll kind of see the approximate savings we believe we'll be able to get over what we're paying today. And so we believe, you know, we'll be able to have a $222,000 gross savings impact over the medications that were filled in the last 12 months. The fee for the program is they take a percentage of savings. So if they don't save anything, and let's poly this out, let's say this absolutely falls on its face, none of it works, nobody enrolls, it's not gonna cost anything. If it does work, good, you know, the greater the plan saves, they take a 25% savings over what's being paid now. So let's say they save, they move someone off a drug and they save $10,000 a year, they would take a $2,500 fee to save that as their fee. And so, you know, we'd be seeking your approval to allow us to bolt this onto the plan, and enroll this out to employees for this year's open enrollment effective January 1, 2025.
We're also hoping that this will help our stop loss
Yes.
for the next year, because we have a couple employees that are high claimants that are gonna, we have one for sure that's gonna be
Yeah.
over 100,000.
So if you look at, so if you're actually looking at the drug page here, drugs number 2 and 3, the one called Pulse and the one called Amgevita. You can see $88,000 spent and $84,000 spent. Each of those is only one person. And so when those one people are accumulating those high drug spends, it's pushing against that stop loss threshold. which is part of the reason we're getting some of that increase, right? So if you're a stop loss and our threshold set at $100,000, and I know you're gonna have $100,000 in drug spend this year, any dollar over that now I have to pay out. Well, if we're able to reduce that hopefully in half or more, now there's more of a window there, which should help our stop loss pricing going forward and upcoming renewals going, so. Secondary kind of consequence. Yes, it's good for the employee, they'll be able to source their medications for cheaper. Yes, it's good for the plan, because they'll be able to save off the kind of gross cost. And third, hopefully it'll help us provide a more stable plan, and, better stop loss renewals going forward as well.
This is optional.
Yeah, employee, we don't, employees,
Patient.
yes, and so that's why,
Employee.
yeah, so during open enrollment, we'll do our best to educate, help employees enroll, identify if they could be eligible. Cause it's in their best interest too, because they'll be able to get the medications much more affordably as well.
This is a personal thing, will they be able to, so here we go. My pharmacy decided to call me and tell me that I needed to be on medication.
Mhm.
I told them, buzz off.
Yeah.
And they're like, well, I don't know that you can stop those things. I mean, you can, obviously.
Yeah.
Is that an option, if
Yeah.
people don't want it? Cause I've got a doctor that's working with me. I've gotten off most medications. Blood pressure's the only one, but, that's a little bit,
Yeah, so this only kicks in after it's gone through the approval, right? So this.
well, I understand.
Yeah.
I'm just wondering, it talks about member
Sure.
outreach and stuff like that.
Sure.
If are there, and I just like, if people don't want to hear from them on that, but want to hear other things, okay, but it says customizable flyers. If they said, okay, well, don't push me to more medication.
Yeah.
I don't think it's a problem anyway, but, but some of these other things maybe I want to hear about. I mean, I guess just, you don't know, I know, but I think it would be nice for people to have some options there. I know most people think, okay, give me some medication and I'll just take care of my problem. Anyway, well, I was not that person. And I said, I don't want to hear from you again.
Right.
I know some people are on Cosentix, they would be happy to save
Mhm.
Yeah.
percent of it,
Mhm.
cause it's ridiculous,
Yeah,
like some
it
of
is.
these, but anyway, you gotta have it to survive, so.
Mhm. Yeah, and our plan's running really great this year. The only thing we're getting our butts kicked on is pharmacies.
Yeah, if we look at it, in the past, medical typically runs like twice pharmacy, so if I'm spending $500,000 on medical. I might spend $250,000 on pharmacy spend, on average right now, there's definitely some swings. In the past years, that's how the plans run. Well, this year, medical is running great and pharmacy is running as high as the medical, and so, we're really just kind of. We've done a lot of good things and Heather has done a lot of really good things with the medical plan. I think this would be like the next step to, really kind of help bring everything together. And hopefully just keep on improving that going forward.
Your health plan has a serious drug problem.
I love the branding, right? In my
Oh,
opinion.
yeah. Entertain a motion to allow this to be offered as an optional.
I make a motion that we tag script sourcing onto our insurance plan as an option.
Second.
Any other discussion? All those in favor, signify by aye.
And I only have one agreement for this, but there's signatures on the last 2 pages, so you can take your time to review that. But the last 2 pages are the ones that we'll need. Signature, and this is just kind of talking about the program we're gonna be going through, how they kind of calculate the percentage of savings. And go through kind of just the overall high level agreement.
See you later, do you want?
Sure, no, you can get it to me later,
Okay.
you can send it over to her, that's fine, yep.
Yeah. I'm gonna send this over, I can send this to Tyler.
Yep, you can send it to Tyler.
And then just. We haven't gone over the ancillary stuff yet, as far as we've been looking for another dental plan.
Any of them?
Right now we have MetLife. This year, for some reason, it seems like people have had a little bit of issues, so I've had more complaints than I ever have. So we are looking at options for that, which we're gonna present that to the insurance board. And then I did go to council and ask for more money per employee per year for insurance. They gave me half of what I was asking and then asked that we have the employees help with the other half. So the plan is to hopefully keep family plus spouse plus child the same as far as rates, and then maybe raise it $10 for single, just to try to. I mean, we're paying $25 per pay for a very rich plan, so I think $10 is fair for that, so. That's the plan on that. We haven't set the prices 100% yet, we're still working on things, but. Just so you guys are
Employee and
aware of that.
spouse.
Employee spouse hopefully staying the same. We plan on not making any changes to those, because that was, over the last couple of years, I really tried to get those down, and we've gotten stuff down a ton in the last couple of years, so. If we could just bump that, plus the employee up $10 a pay, kind of outweigh things, so. That's a plan on that, nothing crazy though. That's all really with that, unless you guys have questions, anything.
We should be able to get help from the council, more so than that. Because
I mean, eventually it's
remember,
probably gonna have to too,
when we
because,
went with the self-insured, it was asked, could the savings we have be applied the next, so we have some money, right?
the account's been, with how high prescription's been, the account's kind of
Leveled out.
leveled. I mean, we don't have a ton of. Like a pot, like how we used to have, it. We
Right,
could use for
right.
anything else, you know? So that was the hope, was if we could get a little bit more money from council, that we could start building that back up, where we could do our biometric screenings. Maybe do some kind of wellness program and stuff, but right now, with the way we've been getting our butts kicked on pharmacy.
So, this is a good
that-
step then.
Yes.
Yeah, hopefully this
I hope
kind of
that-
helps us get back on track.
Okay.
Yeah.
Good job.
Thank
Yeah.
you. Yep.
Keep it going.
Yeah.
Yeah, your wellness program would be fun, but I
Mhm.
know it's.
Yeah, I just have to get the funds for it. So. We'll see, maybe we see how this drug sourcing goes, and then if it seems well, then maybe mid-year we can look at something to do.
Maybe even look to the employee put in a little for a wellness program.
Yeah,
Yeah,
what we've seen some other employers do is if you enroll in the wellness program, we even give you a little discount on your rates, or
Sure.
penalize those who don't, or figure something out to
Yeah,
incent
I
people to.
wouldn't say penalize.
Yeah, I know,
Yeah,
yeah.
yeah.
There's the same,
Yeah.
we'll give you a.
yeah.
Whoops.
Yeah, I know.
They're gonna say, well, my rate went up $10.
Yeah.
They won't hear anything else, they'll just hear you said.
That's all I have.
Yeah, I just know it. But now that, it's a silly thing, but the wellness program is,
Mhm.
you know, pretty neat.
Yeah,
There's that little competition for 10,000 steps a day since August of
Right.
22. I think.
yeah,
And I've got a youngster beating me now, so I gotta catch up to him.
yeah.
Although there's so many, I'm like, I ain't gonna get you in a day. I just.
Yeah,
Anything else?
I think so.
All right,
I'll make a motion, we adjourn.
I second that motion.
all those in favor signify by aye.
Aye.
Thank you.
Thank you.
Thank you.